Hello everyone, my name is Hazel Evalle and I'm presenting my discussion on supporting health communication campaigns. Sleep forms a vital part of human life. It allows the body to rest and recover its essential functions. In the course of life, one may experience sleep-related challenges as a result of life experiences such as stress or trauma and biological factors such as aging. Sleep disorders are common problems of older adults and usually remain underdiagnosed. Among the sleeping disorders affecting the elderly, the most prevalent conditions is chronic insomnia. Long-term difficulties falling asleep or remaining asleep describe chronic insomnia. Acute insomnia is a brief occurrence resulting from life events such as stress or trauma. Many people experience acute insomnia now and then the condition resolves without the need for drugs or psychotherapy. Chronic insomnia is a long-term condition characterized by lack of sleep or difficulty falling asleep at least 3 nights per week and lasts at least 90 days. Chronic insomnia has many causes including clinical disorders, use of certain drugs, changes in work schedule and environment, and unhealthy sleeping habits among other causes. Chronic insomnia can be comorbid, but the relationship is difficult to ascertain. According to the National Institutes of Aging, insomnia is a common problem of the elderly. According to the CDC, insomnia is one of the sleep disorders affecting Americans alongside sleep apnea and narcolepsy. In the elderly, insomnia is characterized by waking up tired, feeling sleepy in the daytime, waking up several times in the night, and taking a long time before falling asleep. The purpose of this video is to draw attention to the issue of insomnia in the elderly that is often unrecognized and in the process educate you, the audience. The rationale is that insomnia in the elderly is a significant public health issue because it affects millions of elderly and young adult Americans and costs the U.S. healthcare over $100 billion annually in direct and indirect costs and reduces the quality of life, hence the need to create more awareness about the problem. 1 in 3 adults do not get adequate sleep. Lack of sleep also predisposes one to chronic diseases and conditions like obesity, heart disease, and type 2 diabetes mellitus. Insomnia affects 16 to 40% of general public in developed Western nations. Insomnia is a prevalent condition affecting the elderly population and is usually misdiagnosed due to the misconception that it is a normal part of aging process. More than 50% of older adults have at least one chronic sleep problem. Hence, as the elderly population increases, the burden will also increase. In the USA, insomnia affects over 99 million of Americans, most of whom are males. Insomnia reduces performance in the workplace and increases absenteeism and accident risk. Up to 6,000 fatal accidents are as a result of drowsy driving, which is caused by untreated sleep disorder, not getting enough sleep, and medications. Chronic insomnia is a prevalent sleep disorder among elderly adults, hence the condition reduces the quality of life among elderly adults. Moreover, 67% of adults aged 50 and above use prescription sleep aids, and persons with insomnia are more likely to use healthcare services than those without. Understanding the physiology and sleep changes related to aging is valuable in managing sleep disturbance in the elderly population. Treatment for chronic insomnia is through behavioral, psychological, pharmaceutical drugs, or a combination of any 2 or all. Practices such as having a regular sleep schedule, keeping the sleep area quiet and dark, and avoiding large meal and alcohol can improve night sleep. Pharmaceutical and non-pharmaceutical interventions are used to manage insomnia in the elderly. Hypnotic medications and cognitive behavioral therapy for insomnia are the common interventions for managing insomnia. Cognitive behavioral therapy for insomnia is cost prohibitive and the services are extremely limited because of the lack of many qualified practitioners, hence not commonly used. There are different categories of pharmaceutical interventions. However, a majority of the available pharmacologic interventions for managing insomnia in the elderly population are associated with burdensome side effects. Mixed evidence exists on the efficacy of melatonin in the treatment of insomnia. However, melatonin is preferable because of its benign side effects compared to sedative hypnotics, but its effect is smaller compared to other medications. For instance, research done by Lee Seng Williamson found that melatonin supplements did not affect the patient's memory recall, psychomotor functioning, and other skills the morning after compared to sedative hypnotics. The goal of this video was to draw attention to the issue of insomnia in the elderly so that the target audience can be informed to take actions such as recognizing the problem as a significant risk to public health. The video presentation was used to communicate my topic audiovisually. The choice of the medium was because it is more engaging when compared to text and flexible as the audience can pause and rewind and watch the presentation all over again. The infographic was another way I choose to communicate visually my topic, insomnia in the elderly. The choice of the infographic is because it can be used to summarize the key facts and points about the topic and thus allow the audience to appreciate the health issue. The goal of this video was to draw attention to the issue of insomnia in the elderly so that the elderly individuals in society and other stakeholders can be informed to take actions such as recognizing the problem as significant to public health. Moreover, the video can inform the elderly on ways to manage sleep complaints. Thank you for listening.